it's a pleasure to be here.
What is the present situation of health services, particularly reproductive health in Nepal?
Well, I think there's lots of things to be proud of. There's lots of progress. But on the other hand, I think there are lots of things that we still all need to think about and address. In one way, we're on track to meet the Millennium Development Goals. The maternal mortality ratio has declined fairly significantly in the last decade, but we still have some way to go.
Amidst the report saying that people residing in rural areas are deprived of health services. So how do you think can we improve the situation?
I think that two things can be done to make sure that the poorest do actually receive those. The first is to ensure that the poorest people in our society are aware of the needs, they're aware of their rights as stipulated in the Constitution, the draft Constitution, the interim Constitution, for example, their right to information, to understand what it is that they're entitled to. So their awareness of those sorts of issues. And secondly, the responsiveness of the public sector and also the private sector to respond to those needs.
What needs to be done to tackle the maternal mortality rate problem in Nepal?
Somebody said recently, actually it was somebody from the Ministry of Finance, that they see health not as an expense but as an investment. And I think if we are to tackle maternal mortality and the other things related to maternal mortality, for example, maternal morbidities, many women suffer from illnesses or diseases, disabilities related to their pregnancy. So they may not actually die. Far more women suffer after their childbirth than actually in childbirth. So it's very important to look at other things like uterine prolapse, which affects 600,000 women in Nepal.
Nepal is in transitional phase and we are having social and political upheavals. So do you think that the present peace process will gain sustainability?
I sincerely hope so, and I think we all hope so, and I don't think there's an option about that. I think the question is how you go about doing so, and as I said earlier, this link between development and peace is really important to understand. So I think that the way in which we involve citizens in deciding their own plans, their own aspirations, involving them in the process of drafting the new constitution, for example, it's very much part of development as it is part of politics. And I think that if we can continue, I mean, it's very impressive, the consultative process that Nepal has undertaken. The way that Nepal is articulating a vision for social inclusion. Those are the dimensions related to development and social policy and also, I guess, at the political level that will ensure the peace and will sustain development in the future.
You just mentioned that there is a gap between policy and implementation. So how do you think should that gap be bridged in order to uplift the health services?
It's a very good question. It's the challenge, I think. And I think many countries are addressing it, and I also actually think that Nepal itself is facing up to that challenge. It's about accountability. It's about the clients understanding what it is, what their rights are. It's about duty bearers fulfilling the responsibilities that they have. It's about us all holding our policymakers, our constituent assembly members accountable for their actions. It's about us as responsible citizens being accountable for our actions. So I think accountability and trying to find ways in which accountability can be strengthened is a very important way of bridging this gap.
Which do you think is the more appropriate way in relation to the aid effectiveness in Nepal?
You know, Pragya, sometimes I think, and I'm not sure this is official policy, so this is a personal view, aid will be most effective when we don't give aid anymore. The longer term goal has to be that countries do not require external financial assistance, and that's an important thing to bear in mind. Aid should not be seen as a panacea. Aid can be a catalyst. Aid obviously helps fill gaps, but in the longer term, we have to be thinking about how government itself, the private sector and citizens themselves, how they mobilize the resources that are needed to achieve their goals.
There is a lot of talk in the international media about the global financial crisis. And do you think the discussion is relevant in Nepalese context as well?
Very much so. Very much so. I mean, firstly, Nepal is part of the global community. Nepal and Nepalis work in different parts of the world. We're in an interconnected global system of finance and economics and trade. I don't think any country is immune or isolated from the impacts.
Thank you.
Thank you.
Well, that's all this week we have in focus. Hope you enjoyed the show. Do write us at ntvnewsroom@gmail.com.